School nurses have many roles. School nursing is not just about caring for sick or injured children. It is also about helping children and their families stay healthy and manage their chronic health conditions. School nurses educate students, family, and staff and support initiatives that promote health. By making prevention a priority, we are giving our students the opportunity to live healthier lives. Children with special health needs are included in the regular classroom setting as authorized by federal and state laws. School nurses perform a critical role within the school health program by addressing health problems experienced by children. An individualized health care plan is developed for students with chronic conditions, and when appropriate, an emergency plan is developed to manage potential emergent events in the school setting. School nurses are responsible for caring for any health issue within the building, whether it involves a student, a staff, or a visitor. The health office is like an emergency department, except each nurse stands alone. She is the team caring for whoever comes through the door. Sick or injured persons may come to the health office, or the nurse may need to respond to an emergency outside her office. Nurses follow standing orders provided by the school physician. Student-specific orders are provided for students with special health care needs by their primary care provider. Offices are equipped with oxygen, emergency medications, first aid supplies, and each building has at least one defibrillator. With a district student population of 7,433, 4,384 students have a health concern. An additional 711 students have health issues that are medically complex. These students require daily treatments or close monitoring by a nurse. 31 students are medically fragile. They face each day with the possibility of a life-threatening emergency requiring the skill and judgment of a nurse. One student is nursing dependent and requires frequent one-on-one skilled nursing care. These are the health issues in the Hillsborough School District. Some of the most common medical conditions facing students include asthma, food allergies, diabetes, and seizures. Although common, they remain serious and require the careful planning of care and accommodations so that students can learn safely with their peers. The school nurse plays a pivotal role in working with the family, student, and staff during this process. Routine hearing and vision screenings are conducted by the school nurse. If an abnormality is detected, the nurse works with the family so that appropriate assessment and treatment can be performed by a qualified physician. If lack of insurance or cost is a barrier, the nurse coordinates referrals and assists the family in obtaining appropriate treatment. Some students may come to school with a diagnosis of a hearing impairment and require accommodations in the classroom. The use of assisted hearing devices such as an FM system or hearing aids may be necessary. Eyeglasses are a common accommodation for students, and nurses ensure that the students have their eyeglasses available. Children who have difficulty seeing or hearing will most likely have difficulty learning unless appropriate accommodations are made. Physical disabilities may be temporary or permanent. Students with life-altering disabilities such as muscular dystrophy or cerebral palsy attend our school. Orthopedic injuries may range from a sprained ankle to a student who is recovering from orthopedic surgery. Treatments and mobility accommodations, such as the use of crutches, a wheelchair, splints, or braces, may be necessary. The school nurse communicates and works with the education team, the physician, the parents, and the student to ensure appropriate accommodations are in place and the student is attending school safely. On a daily basis, our school nurses care for students with acute medical conditions. We also ensure the health and safety within the school for students who have undergone life-saving procedures and require medication and surveillance during the school day. Yes, here in Hillsborough we have students who have had a heart transplant, kidney transplant, lung transplant, bone marrow transplant. Care is also provided to students with extremely rare medical conditions. In some cases, the condition may be so rare that it exists in only 1 out of 400,000 children. Care is provided to students with chronic medical conditions such as Crohn's disease, celiac disease, rheumatoid arthritis, cystic fibrosis. We care for students with heart conditions and even a student who has a pacemaker. The care of chronic medical conditions may vary. One student may need to be catheterized several times during the school day. Another may have issues with bowel control and require assistance with basic toileting. Another student may need to have blood oxygen levels monitored to ensure adequate oxygen levels and lung function. Care may involve daily assessments and administration of medication. Students today face many family crises: homelessness, immigration, poverty, and violence. All of these issues increase both their physical and mental health needs. School nurses look at the whole student and consider all aspects of their health and how it impacts their learning. Education and teaching takes place every time we work with a student. Last year's flu season brought a lot of attention to the flu and a possible epidemic. Nurses in the district educated staff, students, and their family about upcoming flu clinics and worked to ensure that they received the vaccine. Education took place teaching ways to prevent the spread of illnesses. Some roles and responsibilities of the nurse also include mandatory staff education and training on universal precautions, diabetes education, as well as asthma education and awareness. School nurses serve as members of the IEP team, 504 committee, and INRS committee. They also serve on the Health and Safety committee and are members of the Crisis Management team. According to the CDC, improving student health and safety can increase a student's capacity to learn, reduce absenteeism, and improve physical fitness and mental alertness. Promoting health and safe behaviors among students is an important part of the role of the school nurse. The fundamental mission of schools is to provide young people with the knowledge and skills they need to become healthy and productive adults. There is growing recognition of the relationship between health and academic performance. School nurses support academic success by supporting the health of our students. I would like to take the opportunity to recognize the nurses in the Hillsborough School District who care for all of our students and staff. Maria Loyacano and Len Beagle from Hillsborough High School, Linda Heffernan, Hillsborough Middle School, Krista Williams, Hillsborough Middle School and Auten Road Intermediate School, Valerie Newman, Auten Road Intermediate School, Marianne Zagari, the nurse at Amsterdam School, Joanne Gagliardi, Hillsborough Elementary School, Susan Yersizen from Sunnymead, Ursula Naklicki, also known as Nursula, at Triangle School, Annette Haverson from Woodfern, and Ruth Stanley, the nurse at Woods Road. The students at Hillsborough need their school nurses. Because of them, our students are healthier and in the classroom learning. Thank you. Wishing you all good health and a good evening.